What do our patients experience on their journey having lens replacement? Well, it begins most importantly with an assessment at Custom Vision Clinic. That's where we can identify a patient's eye health, link it to their visual needs and their lifestyle, and work out the best lens replacement plan for them and the best lens technology. Then we take time with the patient to make sure that they understand the patient journey, the treatment itself and the recovery. I like to operate on the eyes on different occasions, ideally a week apart. Now, for patients with relatively small spectacle prescriptions, it's no problem walking around for a week with one operated eye and an eye that still has early cataract and a small need for spectacles. In the first couple of days they might use the spectacles a bit. After a couple of days, the new eye will probably be seeing so well that actually they'll start to walk around without glasses and really function quite well. For my patients who have larger spectacle prescriptions, so once we're more than ±2, it can be a little bit uncomfortable to have a spectacle lens correcting the unoperated eye whilst walking around with a clear lens in front of the operated eye, which obviously doesn't need a spectacle prescription anymore. And the reason for this is that the images are different sizes. So if you wear a -4 spectacle lens, it actually shrinks the image a little bit on the retina. This does explain some of why we often see our patients seeing significantly better after their lens replacement surgery to treat early cataract change and short-sightedness. Not only have we created a clear view and clear optics, we've actually given them a larger image to work with on their retina. If these patients are contact lens wearers, they can get through that 1 week period by putting a contact lens on the unoperated eye. And then the image sizes are so similar that actually the vision will feel quite balanced. So I don't want to trivialise that week. It can be challenging if a patient is a non-contact lens wearer, has a big spectacle prescription. They're going to be using one eye or the other. They probably shouldn't drive and should just generally be taking things steady because their depth perception won't be what they're used to. This will all feel much more comfortable than once we've operated on the second eye. And a couple of days after treating the second eye, the vision will start to work nicely together and they'll really go from strength to strength. The reason for separating the days for the procedure is partly risk management. So my most feared complication is infection at the time of surgery. The risk of that is 1 in 10,000. If it is going to happen, it's usually day 3 or 4 that a patient will present with signs of infection. So by separating the procedures by a week, we know that we've got the first eye safe, banked, and that we can move on and treat the other eye. But also, I learn a little bit about the patient after that first eye, both in terms of how they are with the surgery, and the vast majority of patients are amazing. We just use some very gentle eye drops, a little bit of anaesthetic inside the eye. They feel nothing more than a little bit of pressure at a couple of points, feeling like their eye's being washed, and after 7 or 8 minutes I'm saying, we're done, and we're just sitting them up and getting them back down to the ward so they can have their discharge medicines. But sometimes a patient might require a little bit of extra anaesthetic or sedation, and we might find that we could improve things a little bit for them on their second experience, and that's what I'm always after, making everything as good as it possibly be for the patient. But also I learn how they respond to the measurements that we undertake. Now, we've invested in the best, latest technology for measuring eyes for lens replacement surgery, and the latest 5th generation formulae for calculating lens powers. And this has resulted in a 10-fold increase in accuracy of the outcomes of my lens replacement surgery. When I meet the patient after the treatment of the first eye, that's the first time I see, okay, this is how they respond to the measurements and the calculations, and occasionally I'll slightly adjust the lens power selection for the second eye. And of course, if I was treating both eyes at the same on the same day, I wouldn't have that window of opportunity. It's really exciting to meet up with patients at their first post-op visit after the second eye, because there is a wow factor to this, and it's a real delight to meet people as they're starting to enjoy life with improved quality of vision and spectacle independence, and you start to see that return of confidence and that return of enjoyment in life. Do please book a consultation with me here at Custom Vision Clinic. You'll meet my team who will take you through a series of assessments and then have a consultation with me where I can collate all the data combined with information from you so that we can pull together a full assessment of your eye health and a treatment plan to improve your vision and increase your independence from spectacles.